to deal with the latest COVID outbreaks in the country.
Ladies and gentlemen, good afternoon. Welcome to the press conference of the State Council Information Office to implement the important directives of the CPC Central Committee on COVID response. Today, the Information Office is having this press conference on rigorous COVID response and will take your questions. Today, we have with us Mr. Wang Hesheng, Vice Minister of the NHC and Head of the National Disease Control and Prevention Administration, Mr. Zeng Yixin, Vice Minister of the NHC, and Ms. Jiao Yahui, Director General of the Medical Administration and Management Bureau of the NHC. Now, Mr. Wang, please. Friends from the press, good afternoon. Thank you for your interest in and support for epidemic prevention and control. Let me brief you on the current priorities of COVID-19 response, and then my colleagues and I will take your questions. The CPC Central Committee and the State Council attach great importance to COVID-19 response. General Secretary Xi Jinping personally directed and deployed relevant efforts and made a host of important instructions, emphasizing the need to uphold the overall strategy of preventing imported cases and domestic resurgence, and the overall dynamic zero-COVID policy, and also the need to coordinate COVID response and economic and social development. Yesterday, General Secretary Xi chaired a meeting of the Standing Committee of the Political Bureau of the CPC Central Committee to analyze the COVID situation and instructed on vigorous COVID response. General Secretary Xi emphasized that perseverance brings victory. The regional authorities and government departments must fully recognize the complex, arduous, and enduring nature of COVID control at home and abroad, further mobilize resources, build consensus, strengthen confidence, keep up the hard work, and make meticulous and solid efforts to continue to contain the virus. We will continue to put people and their lives first, stick to the science-based, targeted, dynamic zero-COVID approach, and curb the spread of the virus as quickly as possible. We need to make our COVID response more science-based and targeted, continue to improve our response measures, maintain strategic focus, seek steady progress, and coordinate COVID response and economic and social development. We will take more effective measures to achieve the best results in COVID containment with minimum costs and minimize the epidemic's impact on economic and social development. The National Health Commission and the National Disease Control and Prevention Bureau have been earnestly implementing the important instructions by General Secretary Xi in response to the multiple local clusters in parts of China. We have worked with relevant authorities to strengthen guidance for key regions to ensure early detection, reporting, quarantine, and treatment, and ensure that COVID measures will be strictly and earnestly implemented. We'll take more effective and targeted steps to effectively control local clusters as quickly as possible and foster an enabling environment for people's life and for economic and social development. First, we'll work swiftly on emergency COVID response. In recent weeks, China has seen local clusters occurring widely and frequently in multiple regions. The State Council Interagency Task Force immediately sent national working groups to provinces including Jilin, Shandong, Guangdong, and Heilongjiang to guide their local COVID response. We have worked with the localities to jointly assess the COVID situation, work out countermeasures, accelerate testing, screening, investigation, and regional checks, ensure early detection, reporting, quarantine, and treatment, ensure sound medical treatment of patients to fully stem the spread of the pandemic. Second, we need to cement the defense against imported cases. We need to ensure sound prevention for people, objects, and environment, step up personnel management at the ports of entry, ensure strict closed-loop management, and increase the frequency of tests. We also need to guard against risks from imported cold chain food and high-risk non-cold chain objects, step up management of the border areas and the ports of entry, clamp down harder on illegal entry, work vigorously to build a joint prevention and control mechanism at border areas with neighbors over land, and jointly ensure sound epidemic control and customs clearance for cargo at the border areas. Third, we need to further enhance our capacity to prevent, control, and handle COVID infections. We'll improve COVID response plans on monitoring, epidemiological investigation, quarantine, medical observation, community response, sample collection and testing, and ensure those tested positive will be reported and investigated immediately, and that control measures will be in place before screening. We'll also regulate work on the screening of people at risk, management of close contacts, and determination of at-risk areas. We would emphasize both modern and traditional Chinese medicine, ensure sound regulated treatment of patients, and will fully strengthen the responsibility of medical institutions and in-hospital infection prevention and control measures, and carry out records-based management of over 7,000 fever clinics and more than 800 designated hospitals. We'll also step up our testing capacity with a national testing capacity of over 40 million per day. Fourth, we need to ensure sound vaccination. As per directions of the Joint Task Force, and following the principle of informing the population for their consent for voluntary vaccination, we have guided the localities to steadily advance vaccination and booster rollout, and to enhance and increase the vaccination rate. The gains we have made in COVID response do not come easily and should be cherished. Going forward, we will work with relevant authorities to implement the decisions of the CPC Central Committee and the State Council, keep strengthening our efforts on the priorities in COVID response. First, we'll bring local clusters under control as soon as possible. We'll guide the key areas to accelerate testing and screening and epidemiological investigation and management of people at risk to achieve zero COVID in the society. Second, we need to firmly guard against imported cases and ensure sound long-end prevention and control before the entry, highlight closed-loop management, expand monitoring of key groups, ensure the authorities at the ports of entry will shoulder their responsibilities and step up patrol and deployment of anti-COVID resources along coastlines and riverbanks. Third, we would step up routine COVID control in key areas, and we would guide the professionals at schools, nursing homes, prisons, and other crowded areas such as transport stations, supermarkets, and also those working on cold chain industry and logistics to strictly implement COVID countermeasures. Fourth, we need to further enhance our science-based and targeted COVID response measures. We need to strictly implement the preliminary checks, triage, and first treatment measures, and improve the early warning mechanism. We would also promote antigen testing and nucleic acid tests, guide localities to treat and respond to COVID cases in a science and targeted way, and minimize impact on economic and social development. We'll now open the floor for questions. Please identify yourself before raising the question.
谢谢主持人，中央广播电视总台的记者。 With CCTV, the current round of outbreak is characterized by outbreak at various places, a wide coverage, and a large number of confirmed cases. What is your assessment, and what is the progress of tracing the virus source? What do you think are the reasons? Thank you. Thank you very much for your question. Indeed, as you said, recently we have witnessed multiple outbreaks in various places with a wide coverage. 4 reasons are as follows. First, since December 2021, the global COVID situation entered a 4th wave. There have been 11 weeks in consecutive with over 10 million confirmed cases weekly. The pandemic level globally has stayed at a high level. Since this year, we have seen a rapid increase of confirmed cases in our neighboring countries and regions. So the difference of pressure is becoming more prominent between our neighboring countries and China. In the first 2 months, averagely there have been 91 cases imported daily. This number has been way higher than the 22 cases daily in 2020 and 32 cases daily in 2021. And in March, this number, the imported cases daily, has averagely exceeded 200. Someday even exceeded 300. So the pressure of case importation has been mounting. Second, the Omicron variant, in particular the BA2 subvariant, has been more contagious and less detectable than other virus variants. So it makes it harder to detect and discover the variants at early stages. When they are discovered, they have spread it to quite a wide scope. So it is very hard or more difficult for us to handle the virus. Thirdly, late February was the time when the Spring Festival holiday ended, spring semester began, factory resumed production, which brought a massive flow of population. And also other activities like meeting, training, wedding, and all kinds of ceremonies also magnified and amplified the impact of COVID. Fourth, some may think Omicron variant is not as severe as the previous ones and is no different from flu, so their guard have been lessened. This lower of vigilance has reduced the level of COVID response. According to our analysis, the high pandemic level of the global COVID-19 situation will not end soon. And China will continue to face the situation of multiple outbreaks in various places at the same time with Omicron strain as the main source. The COVID-19 situation in China will be more complicated. And also, epidemiological result has proved that the recent cluster of cases in China are caused by imported cases. And as Omicron leads mostly to mild and asymptomatic cases, so it is harder to detect and discover the source of the virus. And the transmission could be more diverse. In many places, we have discovered many transmission routes at the same time. These features have forced us to increase the sensitivity of monitoring and pre-warning efforts to improve the pre-warning and monitoring mechanism to increase our capacity to detect the virus as soon as possible. Next question, please.
那个后面吧，第3排那位记者，靠边上。对。
谢谢。日本共同社提问，我们都知道中国的
We know that China's dynamic zero-COVID policy has been successful. The recent outbreak in various places may restrict China's manufacturing and consumption and make it difficult to communicate with foreign companies. I want to know if the policy will see any changes in the first half of this year.
Thank you for your question. Since the onset of COVID-19, under the strong leadership of the CPC Central Committee with Comrade Xi at its core, China has always put people's safety and health front and center. We have been strengthening COVID response, which has worked quite well, and we have protected people's health and safety to the utmost. The dynamic COVID strategy was made on the basis of preventing imported cases and domestic resurgences, and on summarizing the experiences we have gained. It is focused on early detection of even minor cases so as to swiftly identify those that have contracted the virus and minor outbreaks, so that every case, whenever and wherever discovered, will be stamped out, so as to minimize and bring to zero the number of infected cases. And the goal of this policy is to minimize the social cost and to contain the virus in the shortest period of time. The core about this policy is rapid response, rapid handling, and rapid blockage. It is targeted because the epidemiological investigation, management, quarantine, community control, and treatment will all be targeted. All the measures will be targeted throughout all these links. And we can see that our COVID response has effectively balanced economic and social development and COVID response. We are the world's one of the world's few main economies that achieved positive growth. And this has not come easily, and facts show that our experience in COVID response has ensured our people's safety and health and facilitated economic growth. Well, in fact, COVID has affected to different degrees the economic and social development of all countries. But the different COVID response and measures will have different impact. When assessing the impact on the economy and the cost of COVID prevention, we need to differentiate the different results, which are caused by the pandemic itself, which are caused by economic growth, and which are caused by COVID response measures. We can't just blame all the impact on the economy on COVID response measures. Second, when assessing the effect of COVID response costs, well, in a more scientific manner, we need to look at 4 dimensions. First is the cost and effect of COVID response. In other words, what are the costs, how many infections are prevented, and how many severe cases and deaths are prevented. I believe the concept of COVID response of our party and country is to put people and their lives front and center and to do our best to ensure people's safety and health. So we can see that the overall number of infections, confirmed cases, severe cases, and deaths are quite low. This shows that China's cost and effect of our COVID response is quite high. the cost and effective ratio is quite high. And second is the efficiency. That is the speed at which we deal with the outbreaks. Usually, within 1 to 2 incubation periods, we would rapidly deal with and stamp out the outbreaks. This points to high efficiency. And third is the efficacy of our COVID response. Through the dynamic zero COVID policy and the targeted COVID response, we ensured normal work and life of most of the people in most areas in China. And it also helped reduce the inconveniences caused by COVID-19 and possible mental problems caused by the pandemic. This shows that while sacrificing the normal activities of an extremely small number of people, we have ensured the normal work and life of most regions and most people. Fourth, the outcome or the economic benefits of our COVID response. And we need to look at the larger picture when assessing the effectiveness of our measures. It is not objective to just look at the costs of the places where outbreaks occur. We need to look at the whole country and the entire economic performance of the nation. Facts have proven that the dynamic COVID policy is consistent with China's national conditions. It is science-based. It is the right approach that has worked well. Although the containment measures have had some impact on the work and life of certain regions, but those impact is short-lived and limited. Any COVID response would come with a price, but compared with people's health and safety, those costs are well worth it. And I would also like to thank the Chinese people for their understanding, support, and coordination and cooperation with our COVID response. And China's experience shows that our dynamic COVID policy is the best practice for a huge country like ours with more than 1.4 billion people to guard against risks of COVID-19 and to put people's lives front and center. It is also the biggest contribution to the global fight against COVID-19.
先第一排的这位女记者。
谢谢主持人。南方都市报恩视频记者提问，请问当前
Thank you
全
with
国的
Southern
疫苗接种
Metropolis.
情况如何？那么使用
What is the latest update on the national vaccination rollout?
与使用相同技术路线疫苗的
What is the
同源加
difference
强免疫有何差异？
between
那下一
the
步如何实施？
heterologous and homologous schedules of vaccination? What is the next step for implementation?
I'll invite Mr. Zeng Yixin to answer this question. Thank you for your interest on vaccination. According to the decisions and plans of the CPC Central Committee and the State Council and the plans of the State Council Interagency Task Force, all local governments are steadily advancing vaccination work. By March 17th, yesterday, over 3.21 billion doses of vaccines have been vaccinated in China, and over 1.27 billion people have been vaccinated. Among them, almost 1.24 billion people have been fully vaccinated, accounting for about 87.85% of the total population. And about booster shot, by March 17th, over 640 million people have received booster shots. In light of China's COVID situation, the need of COVID response, and the research and development of COVID vaccines. Since October last year, the State Council Interagency Task Force started homologous schedule of vaccination, meaning the booster shots would be the same as the ones they received during their full course. And recently, we give further supplement to this vaccination schedule by including heterologous schedule to increase immunization. So the booster shots can be different from the ones they received in their full course. Now we have approved the plan to use adenovirus vector vaccines and recombinant protein vaccines on the basis of inactivated vaccines. And next, in light of our research and development progress, there will be more options. And according to our current policy, for all those eligible for booster shots, they can receive homologous and heterologous schedules of vaccination after 6 months since received full vaccination. And they can choose one from the two. And some are curious about the difference between these two schedules. Actually, there have been studies both in China and abroad about this topic. And the research has proved that both of the two schedules could significantly boost immunity and protection. As I said, over 600 million doses of booster shots have been given. And as this heterologous schedule started a little bit later, so it only accounted about 10% of the booster shots. In terms of adverse reaction, the two schedules, there have been no notable difference between these two schedules of vaccination. We hope that for all those eligible to receive vaccination, in particular the senior citizens and people with underlying diseases, if they're eligible, they could receive vaccination as early as possible. This is not only a safeguard for their own health, but also by doing this, they can protect the whole society. Thank you. Next question, please.
第一排的这位记者。
谢谢主持人。红星新闻记者提问。
Red Star
国
News.
家卫健委公布第9版新
The
型冠状
National Health
病毒
Commission
肺炎
announced the 9th edition of the treatment protocol for COVID-19, which makes important adjustments to the handling of patients with mild disease and others. What is the reason for this revision? Does it mean the COVID policy is relaxed, or is it still necessary for local governments to implement strict control measures as now?
好，谢谢您的提问。那么首先
Thank
呢，
you for your
我想先
question.
明确地回答这个问题呢，就是
To answer your
9版诊疗
question,
方案的修订并不意味
the
着
revision
防
of
控
the
政策的
ninth
放松
version of the
那么
protocol
各
does
地
not
呢，现在
mean the
仍然
COVID
还是要
measures
慎
will be
重地
relaxed
做
or
好
the
新冠肺炎疫
localities
情的
still
防
need
控
to
工作。
earnestly
第一
implement
次呢，我们
related
9版
countermeasures
诊疗方案的
against
修订呢
COVID-19.
是基
The
于
revision
我
of
们
the
国家呢
ninth
2年以来的
protocol,
抗疫的实
the
践
ninth version of the
特别
protocol
是
is
在
based
我们
on our
对德尔塔
experience of the
病毒
past
和
2 years,
奥密克戎
especially
临床病
on
例的观察
Delta
和
variant
研
and
究
Omicron
基于这
variant,
个实践的基础
including
上
our
呢，我们对
clinical
9版的诊疗方案
experience and
做出了
assessment.
修订
So, on the basis of those assessments, we have made revisions to the treatment protocol.
和报告
The
在病例的发现
revisions
当中呢
include discovery and
我们增加了
report
抗原
of
检测
cases,
这样的话呢，我们形成
and we
抗原
added
检测加上核
antigen
酸检
tests
测的这个
which will be a supplement to the nucleic acid tests. And when it comes to collecting the patients, we would also categorize them before we bring them together. And in addition, there are also elements about traditional Chinese medicine's role in COVID response and also the management of the patients after they are being discharged from the hospital. And these adjustments are made in order to implement the direction of General Secretary Xi to ensure science-based and targeted COVID response to achieve the best results in COVID response with the minimum costs. So it is based on this consideration that we have made some adjustments to the latest version of the treatment protocol. As for the patients and the categorization of the cases, we have made it clear in the protocol that the minor cases will not be sent to the specialized hospitals. They will be put instead under centralized quarantine centers. For the ordinary and severe cases and also those high-risk cases, they will be sent to specialized hospitals. That means, in addition to minor cases, all those asymptomatic cases will be sent to the quarantine centers. What I want to clarify is that the quarantine facilities are different from the quarantine facilities for those close contacts, because the minor cases and the asymptomatic cases, they tested positive for COVID-19, yet those close contacts did not test positive, so they need to be kept apart from each other. Some localities have chosen specialized quarantine centers for those cases, and for Shandong and Jilin provinces, they have also opted for makeshift hospitals for minor cases. To put those minor cases in the centralized quarantine centers does not mean that we will just let them be. According to the 9th version of the treatment protocol, we would also arrange for some medics and also medical staff for those facilities, which will help provide targeted treatment to the minor cases, for example, coughs, fever, and clogged noses. And in addition, we would also observe those cases closely. And based on our current practice, more than 90% are minor cases and asymptomatic cases. And there isn't much that can be done at this stage for these cases, but that doesn't mean we will do nothing. We would also put them under close observation to see if there are any changes in those cases. If they become severe cases, they would also be sent to specialized hospitals for treatment. So that is the adjustment we made to the categorization of the cases. As for the standards for discharge or the CT levels, well, in the latest version of the protocol, if the CT level is above 35 and after the symptoms disappeared, if those symptoms have eased, if the cases met all these standards, they could be discharged or be released from the quarantine facilities. This is also based on our practices, which show that for those cases who are recovering, when the CT level is above 35, the active virus will not be separated from them. That means that these cases are no longer transmissible. So those patients can be sent home. And such an adjustment is aimed at making the best of our medical resources. On one hand, we could send cases that really need to be hospitalized to hospitals to ensure effectiveness of our medical treatment. On the other hand, we would also put the medical resources to better use to ensure people's other medical needs can be protected and guaranteed. And such adjustments would help us better implement the principle of putting people and their lives first. As for management of people who are discharged from the hospitals, the period of their quarantine has been reduced from 14 days to 7 days for at-home medical observation. The adjustments at the latest version of protocol does not mean any relaxation of the COVID response. It means we are adopting more science-based and targeted measures to counter the virus.
好，后面吧，第4排这位外国记者。对，后面。
I have two questions. Sorry, one of the biggest ways that dynamic COVID-0 affects the economy is when factories have to shut down and people have to quarantine for long periods. What can the government do to reduce that impact? And do you have any plans to introduce foreign vaccines or other foreign medicines to aid with the treatment of COVID-0, aid with the treatment of coronavirus? Thank you.
好，请翻译一下。
来自彭博新闻社的记者，他想问的是，在中国采取的动态清零政策下，经济由于工厂的关闭和群众长时间的居家受到很大影响。第一个问题是政府如何减少这些经济方面的影响？第二个问题是中国在下一步是否会引入更多的外国研发的疫苗和药物？谢谢。
我来回答一下。首先谢谢这位记者的关注。
Thank you very much.
新冠肺炎疫情发生以来，
Since the start of COVID-19, the National Health Commission and the National Disease Control Administration have implemented the decisions of the CPC Central Committee and the State Council and guided local governments to adopt science-based and targeted approach and prevent case importation and domestic COVID resurgence under the dynamic zero COVID guideline. As the knowledge of the virus deepens, and in light of the changes and real need of COVID response, our anti-COVID measures have been more improved and science-based and targeted. We have entered a dynamic zero-COVID stage with whole process and targeted contain and control measures. We have done the following to improve our detection and defense against the virus. The first keyword is prevention. We step up efforts to prevent case importation. We released a notice on strengthening COVID response of port cities. The notice included steps to improve the COVID response mechanisms in port of entries, to improve the pre-warning system and monitoring system of COVID-19, strengthened management control in land and sea border cities, and strengthened personal protection and closed-loop management of high-risk personnel. We also increased the management control of cold chains and improve the disinfection and disposal measures in port of entries of high-risk commodities and the environment. Second keyword is early. We step up efforts on early detection. Measures have been taken to ensure the frequency and health monitoring and also the frequency of nuclear exit tests in port of entries, designated quarantine facilities, and designated hospitals. Fever clinics have been seen as a warning post to make sure that the fever clinic that first receives the patient takes primary responsibility. The procedures of individual clinics and primary level medical institutions have been standardized when they receive fever patient. Third keyword is substantive. We increased our preparedness to handling the virus. All local governments have been asked to establish an emergency response commanding system to deal with normal and emergency situations. On a national level, we set up 16 national epidemiological expert teams. They work in pair with 8 areas across China. And the local governments are also asked to establish sufficient epidemiological teams, including personnel from public health, disease control, public security, and information technology departments. Regular exercises and trainings have been conducted to make sure that they have enough capacity to deal with emergencies. The local governments have also been asked to have enough personnel to deal with sweeping nuclear exit tests. The fourth keyword is rapidity. We step up efforts on treatment in early stages. The 24 hours after a case is detected and tested positive is gold. So once a case is reported, while we advance the work on screening and re-examining the sample of the positive case, we take simultaneous measures to advance epidemiological study, nuclear exit tests, the arrangement of quarantine facilities, and the management of communities. By doing this, we could make sure that we can make synchronized progress of the tests, isolation, treatment, emergency response, and press release. The fourth keyword is strictness. We step up efforts on the management of designated hospitals and hospital-acquired infection control. The management of fever clinics has been improved to make sure that the facilities meet the standards of controlling respiratory infectious diseases. And for those working in the fever clinics that deal with high-risk population like inbound passengers, residents in mid or high-risk areas, or fever patients in designated facilities. These medical staff working in the fever clinics follow strict procedure in accordance with the closed-loop management. And also we increase the screening of medical staff when they enter the isolated areas. Looking ahead, the NHC and the National Administration of Disease Control will conduct regular training and exercise to increase our emergency response levels and strengthen the risk monitoring and screening in key areas. While we implement the above-mentioned measures in detail, we'll also pay attention to an oversimplified implementation of the measures, or arbitrary implementation of the measures. As for the second question about whether China will introduce more foreign-developed vaccines or drugs, you could relay this question to the competent departments. Thank you very much.
好，请继续提问。
Next question, please.
先前面吧，这第二排这位女记者。
China Daily.
The
9th edition of the treatment protocol for COVID-19 has changed its context from requirement for isolation and health status monitoring for 14 days after discharge to home health monitoring for 7 days after discharge from hospital or quarantine. What is the basis for the amendment?
Thank you for your question. As I mentioned just now, based on our experience and practice, the patients who are recovering from the disease, if their CT level is above 35, their virus cannot be separated from the sample. This shows that they are no longer transmissible. And based on our research of those who retested positive, well, those patients will not cause further spread of the virus. So when those patients' CT level reach 35 or above, they can be discharged from the hospitals. And the second consideration is that in the past, based on our previous experience, those patients will be put under 14 days of quarantine or go to a recovery hospital. Now, those people, instead of being quarantined, can be sent home for home-based health observation, and the period will be shortened from 14 days to 7 days. We have looked into the cases of Delta variants and Omicron variants. When those patients are recovering from the disease, usually within 7 days, they would get fully recovered. So we have shortened the period from 14 days to 7 days. That is also based on our observation and practice of actual cases. That is why we adjusted the period and changed our requirement for quarantine to at-home observation. But for those who stay at home for health observation, they should strictly implement the requirements for health monitoring and observation.
New York Times. Other countries and territories have found that the elderly are the most vulnerable and that the only reliable way to protect them is through vaccination. What percentage of people in China who are 80 or older have had 1 vaccine, or have had 2 vaccines, or have had 3 vaccines for the coronavirus? And what are you doing to encourage these elderly people to be vaccinated fully if they have not already received 2 or 3 vaccines? Thank you.
好，请翻译一下。
来自《纽约时报》的记者，大家都知道，老年人在疫情面前是非常脆弱的。我们也从其他地方看到，为老年人接种疫苗非常重要。因此，我想问，中国在80岁及以上的人群中，有多少人接种过1针、2针或第3针疫苗？以及中国将采取什么样的措施鼓励老年人接种疫苗？谢谢。
好，这个请我们曾主任来回答一下。
这个问题非常关键，非常重要。
Indeed, this is a very important question. The Interagency Task Force attaches great importance to the vaccination of the senior citizens, and they have made several special arrangements for the vaccination to the elderly. The local governments have also coordinated to take multiple measures to encourage the elderly to take vaccination. I know you asked about the question for those above 80s, but I have numbers. I would like to introduce to you the numbers between the age group of 60 to 69. By March 17th, 88.8% of population aged between 60 to 69 received the first shot of the COVID vaccines. And over 86% have received 2 shots, and over 56% received 3 shots. And for those aged between 70 to 79, the 3 numbers are 86.1%, 81.7%, and 48.4%. And for those above 80s, indeed, they are in most need of protection. The 3 numbers are 58.8% receiving 1 shot, 50.7% receiving 2 shots, means fully vaccinated, and 19.7% have received booster shot. And there are about 260 million people above 60. Over 220 million have received 2 shots. And as I said, above 80s, only a little bit over half of the population over 80s have been vaccinated. So the vaccination level is relatively lower than the other age groups. I want to stress once again that vaccination for the elder citizens, especially the people above 80s, is very important because the immunity of this group is relatively lower than the youngsters, and many of the senior citizens have underlying diseases. Once infected, they have higher risk to fall into severe or fatal cases. Since last year, there have been multiple clusters of cases in China, but very few of them were fatal cases or severe cases. But in August last year, in the city of Yangzhou, there were outbreaks caused by the Delta variant. Senior citizens accounted for quite a high percentage in the cases in Yangzhou. There were over 1,300 cases of infection, and 67 were above 60 and were severe cases. Of the 1,300 cases, only 38% were fully vaccinated. And of the 67 severe cases, 65 of them were not vaccinated at all or not fully vaccinated. Also in Hong Kong, recently, we noticed that the mortality rate for the vaccinated is only as low as 0.04%, but this number grows to 1.25% if the infected are non-vaccinated and non-fully vaccinated. And over 90% of the mortality population are senior citizens. The number proves that vaccines is an effective shield to keep these senior citizens away from infection or even mortality. In Hong Kong, we know mRNA vaccines and inactivated vaccines are mostly applicable. And the senior citizens and the people with underlying diseases are the ones that need protection the most and need vaccination the most. So in order to to increase the vaccination rate in the next phase, we'll do the following aspects. First, it will help foster a proper understanding of vaccination. We will emphasize the principle of voluntary vaccination. At the same time, we want to tell them that every individual is the primary stakeholder of his own health and life. Against the background of pandemic, vaccination protects individual, protects their family, and protects the whole society. At the same time, we'll actively respond to the issues of interest of the elder citizens. For example, they may wonder, is the vaccines safe? And answer their questions. Some of them may wonder, are there any side effects? Is it effective? Is it safe? How can it protect senior citizens? Will vaccination intensify underlying diseases? And some may say they are quite indoorsy. Is it still necessary for them to receive vaccination? Only if we answer these questions can we encourage them to receive vaccines, and can they be more effective or active to receive inoculations. Also, the data and some basic knowledge about vaccines will be published timely. And we also hope media will invent some popular ways to promote the basic knowledge of vaccination. Second, we attach importance to the role of local governments and communities. The local governments and communities should mobilize the elder citizens and those living in the communities to receive vaccination on an informed consent and voluntary basis. Third is about the requirements for hospitals and health agencies. When given vaccination to the elder citizens, they should arrange for personnel that is familiar with the physical conditions of the elder citizens to make sure that they can receive health assessment before vaccination and timely observation after vaccination. Fourth is we'll carry out facilitating measures. For example, arranging vaccination trucks to reduce the trouble of travel and waiting time for the elder citizens, and will open green channels and fast tracks for the vaccination of elder citizens. We'll do everything we can to provide convenience for vaccinating the elders. Thank you very much.
好，请继续提问。第一排吧。
谢谢主持人。封面新闻记者提问。
Cover News.
近日，联防联控机制综合组印发文件，在核酸
Recently,
检测
the
基础上增加抗原检
Interagency
测
Task
作
Force
为
issued a
补充。
document
居
to
民自购
add
抗原检测产
antigen
品是
testing
否
as
需
a
要备案？
supplement
如果
to
出现阳性结果不
nucleic
上报的
acid
情况，
testing.
是否有相应
Do
的监
residents
管
need
措
to
施？
file for purchasing their own testing products? Are there any corresponding supervisory measures in case of non-reporting of positive
首先呢，
results.
居民购买自测的抗原检测的产品
Thank
不
you
需
very
要
much.
备案。
First,
那么一旦
self-purchasing
自测发现阳
people,
性以后呢，
the
我们
residents
在抗原检
have
测
no need
方
to
案里
file
面呢
for
也做出了规定，就是
self-purchasing.
如果一旦自测阳性，要及
antigen
时向
tests.
属地的社区来报告。那么
But
社区呢，
if the
要
test comes
安
out
排
positive,
专门
the
的车
residents
辆把
should
它转运到
should
具有
immediately
核酸
report
检测
to
能力
the
的医疗机
communities,
构来
and the
进一步地
communities
做
will
确认。整个的
contact
这个处理
emergency
呢，要
center
进行一
to
个会诊。
transfer
并
the
且国
positive
外联防
cases
联控机制综
to
合组对于各地
medical
呢
agencies
7大
for
本地
further
的
tests.
报告、发现、闭环的管理呢，做出详细规定啊。那么对各个省呢，也提出了相应的要求，要
And
明确自己省的细
all
化
provinces
方
have
案。
made
那么刚才
detailed
您提
plans
到的关于它自测
following
阳
this
性
general
报
principle.
告的问题，是不是需要这个监管？那么这里边呢，我想
As for
还是要
the
提醒
corresponding
我们广大
supervisory
的这
measures in
个
case
群
of
众呢，
non-reporting
一
of
方面，
positive
刚才其
results.
实曾主任也提到了，我们每个
Actually, we
人
have
都是
touched
自己
upon
健
this
康的
topic.
第一责任人。
As
一方
I
面是
said,
为了自己的健康，
everyone
另
is
外
the
呢，也为了
primary
家
holder
人的
of
健
our
康。
own health.
那么同时呢，在疫情防控当中呢，也
So
强调
reporting
是
positive
四
case
方
not
责
only
任。
protects
这四
our
方责任
family,
当
but
中
also
呢，其
is
中有
a way
一
of
方的责任，
protecting
就是讲究
ourselves.
个人的责任。所以基于这些考虑呢，我们也强烈的
Based on this
呼吁我们
understanding,
这些自测的这些居民，
we
一
hope
旦发现
or
了
we
抗原
urge
阳性呢，
that
一定要履
once
行这个报告的职
tested
责。
positive
另外呢，从
by
我们国家的法
self-testing,
律规定来讲，
report
在
immediately
传
to
染
the
病防治
communities.
法等等的这些法律
And
法
also
规当
China's
中呢，
law
也
on
明
the
确地规定
prevention
了
and
公
control of
民呢
infectious
在
diseases,
要履行
there
这个
are
传
clear
染病的
stipulations
报告的这个责任
that
和义务。
everyone
那么
has the
因为没
obligation
有
and
履行这个
responsibility to
责任和
report
义务，导
positive
致传染
cases
病的
to
传播，并且进一步
the
发生了
government.
相应的这些
If the non-reporting has
危害
caused
就要承担
the
相应的
spread
法
of
律
the
责任。
disease
那
or
么在我们
brought
的
damage to
实践当
other
中，
people
大
or
家
other
也
people's
看到了
properties
有
and
多
assets,
个地方对于
they will
这
be
些
held
人呢，
accountable
已经
accordingly.
予以了追究法律责任的
And
这
there have
些
been
实际的判
real
例。
cases
所以呢，也提醒我们广大的群众，
violating
购买
such
抗原检测
stipulation.
试剂一旦发现
So
阳性以
I
后，
want to remind
一定要按照要
the
求来
citizens
进
that
行
if
报告。谢
you
谢。
tested positive by
好，请继续提问。
receiving antigen
时间关系，我们
testing,
最后一道吧。
please report immediately.
第二个。
Thank you.
好，谢谢中国新闻社记者提问。近期
With
国
China
内疫
News
情呈现
Agency,
变多、面广频发的一个特点。
recently
那
China
么各
has
个
seen
省份呢也出现了本土地
cases
区疫情。
occurring
想问
widely
一
and
下，在
frequently
这
in
样一个形
multiple
势之下，对于普
parts of the
通公众的
country,
做
and
好
there
防
are
控，我
clusters
们有哪
in
些的建议？
more than one province.
好，
What
谢
advice
谢
do you
这位
have
记者
for
的
the
提问。
general public to
这个
protect
题我是
themselves?
非常愿意给你回答。
Thank you
因
for
为
that
啊，
question. I'd
我觉
love to
得
take your
这
question.
个做好个人的防护，
I think that
不仅
personal
仅是
protection
像你提到的，在当前疫情比较严峻的时候，应该
is
提
not
醒大家
only
做好。
necessary under
我想在防控
the
的各个
severe
阶
COVID
段，
situation
就是我
that we
们现
face
在这个
now.
防控处于一个平缓阶
I
段，
think it
普通的
is
阶
in
段，
fact
也仍然
necessary
要做好个人的防护。
throughout the pandemic,
我想提这么几条建议。
even when the
第一
cases
条
are
呢，我
not
就
that
想接着
severe.
刚才曾主任的这个对这个老年
As
人接种疫苗
Vice Minister
这
Zeng
个话题啊，接着讲。
talked
我
about
觉得第一位的，
vaccination for senior
应该
citizens,
大家要
I
积极地
believe
去的，然后推动
the
疫苗的
first
接种。
thing people should do is to get
因为传染
vaccinated
病经
and
典理论
protect
就是控制传染源，
themselves.
切断传播
Because
途
the
径，
experience
保护易
we
感
have
染
for
而
containing
保护易
the
感疫情
pandemic is
最有效的手
to
段
cut off the transmission and protect
而
at-risk
且我们的这个疫
population,
苗接
and the
种，
most effective
我觉
way
得
is
现
through
在通过
vaccination.
我们这个疫情防控的这种实践经验的积
And
累，
based on
应
our
该是取得
experience
很
and
好的效果。
practices, the
特别是
vaccination has
这个
really
老年
worked,
人，
especially
这次
for
我
the
们
senior
这个
citizens.
香港的疫情啊，
If
给我
we
们一个
look
特
at
别深刻的一个教训，
the
也是一个逆
outbreak
转。
in Hong
就是我
Kong,
们这
that
些老
is
年
a
人
really
如
hard
果接
lesson to
种
be
率
learned.
低，
If
那么
there is low
这个
vaccination rate among
重
the
症
senior
病亡率
population,
就会很高。
then there will be a
这回香港的
high
这个老人啊，
proportion
刚
of
才这个
severe severe and fatal cases. And I remember there is this question about the vaccination for senior citizens just now. Or some people thought that the old people usually stay at home or at nursing homes. They don't have to get vaccinated, but the difference is really huge for those vaccinated and those unvaccinated, and the outbreak in Hong Kong is a case in point. So we hope that we could all set good examples and encourage our own elder parents to get vaccinated, because they need such protection more than anyone. And the outbreak in Hong Kong shows that there is a huge difference between the vaccinated and unvaccinated populations. And for those unvaccinated, they must receive COVID vaccine shots as soon as possible, because the rate of severe cases among the senior population is really high. And our country provides very good vaccination services, and all the relevant departments are working together to ensure sound vaccine rollout. Our relevant authorities have been working on vaccination at nursing homes, including for their residents, and now many senior citizens understand the importance of vaccination and are embracing vaccination. So we hope that the general public will work with the relevant authorities and provide good services for the senior citizens. So I believe we do need to make the most of our vaccination program. And second, we need to ensure good personal hygiene. And I believe everyone understands how important this is. When at home, we need to ensure sound ventilation, disinfection, and good personal hygiene. And during outings, we need to wear our masks, protect ourselves, keep our hands clean, keep a safe distance, and do not go to the crowded areas or gatherings. And third, we need to follow the requirements for COVID response, including cooperate with the epidemiological investigation or testing, especially work with and follow the requirements at the public places and the venues. For example, show your health code, etc. This is in everyone's interest. And in addition, we also need to keep a close eye on one's own health. Once you have a fever or cough, please seek medical attention immediately and report to your communities. So we hope that we could all work together and build a strong line of defense against COVID-19. Thank you, all the speakers, and I'd also like to thank all the journalists. With that, we conclude today's press conference.
That was a press conference from China's State Council Information Office on the country's latest efforts dealing with recent COVID outbreaks in China. National health authorities has made it very clear that China's dynamic zero COVID policy has been proven effective, and the whole country will stick to this very policy in the near future to deal with COVID outbreaks. And of course, this policy will not change in China. And talking about vaccination, so far 87% of China's whole population has been fully vaccinated. And talking about boosters, about 640 million people in China have got their booster shots, and authorities have also vowed more tougher measures to deal with the recent Omicron outbreaks. Of course, we'll provide you more details in our later coverage. Staying with the topic, the leadership of the Communist Party of China has met to analyze the COVID situation in the country. General Secretary of the CPC Central Committee, Xi Jinping, presided the meeting. He said a differentiated and targeted prevention and control approach